Hello, and welcome to Leader Spotlight. My name is Tracy Clark. I'm the Executive Director for the Louisa County Chamber of Commerce. And I'm really excited to introduce you to and get to know Dr. Denise Bonds, who is the Director of the Blue Ridge Health District here that serves Louisa County. Thank you so much for being with us today. Would you like to, let's just start off with, I think, something simple. Give us a little bit about you and your background. Are you originally from Louisa? Are you from somewhere else? Like, how did you wind up serving this community?
Sure. So I'm actually a native Californian, but ended up on the East Coast to do fellowship training. And my original career goal was to go and do research, particularly in women's health and in preventive medicine. So I took a faculty position in North Carolina after my fellowship in the Boston area. My husband, bless his soul, followed me from the West Coast to Boston and then down to North Carolina, where we were based at. And when he got an opportunity to move to Virginia to work at the University of Virginia, it was his turn and my turn to follow him. So he took a faculty position up here, and we moved here in 2006. That sounds about right. And yeah, and so I did some faculty work at UVA, and then took a position at the National Institutes of Health at the National Heart, Lung, and Blood Institute, and commuted between Charlottesville and Bethesda for 6 years. And that just wasn't going to work. We had kids, we have a farm, and it was great fun. I'm so happy I got to work at NIH for those years. But when this position as health director became available, I realized it was really time to return home. So took this position and haven't looked back, and have really, really loved it.
Oh, that is great. And I love the fact that you live on a farm. I mean, because you could totally relate to a lot of, we're a rural community. So you know what it means to live rural, but you come from California, Boston. Those are, gosh, what a great different environment compared to Louisa County. Glad to have you here. Tell me a little bit about, did you always know as a kid that you wanted to be in the health arena or be a doctor?
No, no. So I actually grew up on a farm. I think people forget that California is actually pretty rural itself. It has lots of big urban centers, but the vast majority is a really rural area. And so I grew up raising dairy goats and riding my pony bareback out in the pastures. So I have all of that understanding of what it's like to grow up in a really rural life and environment, and know what it's like to get up and milk every morning, and be responsible for lots of animals. So I absolutely relate to all of the people who are in rural settings in Louisa County. I actually wanted to be a veterinarian growing up because of that. And where I went to school, that was more competitive than going to medical school. So I opted for medical school instead.
Wow.
And really have enjoyed it. It's been a great career to have. Opens up lots of doors.
Yeah, what is it, the science that drives you, or is it the just taking care of others? Both of those, you got to have a good, balance to be successful. But like, what is really what drew you into that arena?
Yeah, I think initially it was the science. I practiced and saw patients early on in my career and really enjoyed it. But I also really like making a broader global difference in people's lives, and research was an opportunity to do that on a really scientific scale. Being a health director is an opportunity to do that on a more intimate scale. I like to explain to people that as the health department, we have 250,000 patients that we're responsible for, because our job is to make it safe for people to live and work.
Yeah. Gosh, and there's never been a more critical time, more important time than now for such a task. Tell me a little bit about your experience with the most recent pandemic and how that's kind of changed your responsibility or anything about that.
Yeah, so working in communicable disease is really a part of bread and butter of what the health department does. So in that way, we were very prepared. I think what probably took all of public health by surprise was the scale and magnitude of this response. So just to give people an idea, the Blue Ridge Health District covers 5 counties in the city of Charlottesville. And so we're responsible, as I said, for about 250,000 individuals. And we have a staff of somewhere between 90 to 95 in pre-COVID times. Right now, the last count I had, our staff is up to about probably 250 individuals. And that was the magnitude that we needed to be able to answer everybody's questions through our hotline, respond to all of the diseases, provide testing for the communities, and now to provide and ramp up a major vaccination effort.
Yeah. So how did you, as a leader, how did you handle such a significant increase in terms of staffing in such a short timeline? What were some of the things that, or resources that you had to, engage with to be able to handle that and transition smoothly?
Yeah, so the first thing I did was give permission to all of my senior staff to hire as they needed. And that was a little bit of a precarious position financially. Public health is funded from a whole variety of sources, and public health in the state of Virginia, we're actually a state agency, even though we act very locally and are responsible locally. And I think that caught many health departments off guard. They weren't prepared to take the risk of being able to pay for those individuals. But it was pretty clear that the federal government was going to come through with a lot of money very quickly. And so we really hired rapidly. We brought a lot of people on contract quickly to help us out.
Yeah.
I think the other, and full credit to my senior staff, one of my staff members, Rebecca Schmidt, who's really just a whiz at this, sought out foundations locally and said, we know we need to provide this service. We don't have a funding stream for it now. Would you provide us with that funding stream? And they did. And so it was really a combination of taking the risk to bring on the people that we knew that we would have, but also not being afraid to ask for local resources.
That is such a good point to bring out. And also I want to acknowledge the business community and the community at large, going through the pandemic. So many people just stepped up in a heartbeat to assist. And certainly with the health department, I know, you guys were bearing the brunt of battling this, and to be able to do that and have such support, that's great. As the chamber, our focus was how do we support these businesses and stuff. And for the first time, what I thought was very interesting was there wasn't one person in our community that wasn't impacted by this. It was just everybody, and everybody was facing that immediate pivot, adjust, whether to face change or not. Everybody was kind of thrown into this chaos of change. What do you feel like for you as a leader? What do you feel like was your greatest asset in being able to manage that amount of change and that amount of stress so quickly? Did you have something that you did, a routine, resources, books? Was there anything that kind of helped you to manage all that?
Yeah, so first, I'm going to give, again, full credit to my staff. I think that the number one thing that you can do is surround yourself with people who, one, fill in your own gaps, and two, are really excellent at their job. And then the other thing that I think is really critical is to get out of their way, to let people do their jobs, do what you have hired them for, and trust that they're going to do an excellent job. And all of the staff here at the health department really stepped up very quickly, and it exceeded expectations. So
That's
I
great.
think the number one asset I had was all of the really great and dedicated people here who worked many, many hours of overtime. Got here early in the morning, we're often here until late at night, worked 7 days a week to respond to this. I think the other thing is the reason I like public health so much is it changes all the time. And I'm an individual who gets bored pretty quickly. So in fact, this the requirement to respond to lots of different things just appeals to my personality generally.
Yeah. So you were pretty much ready, primed and ready and adjusting, and that's great. I think did you have any particular things that kind of were uncovered that now you are going to implement within your organization because of such a quick change?
Yeah, I think one of the things that public health does in any emergency response is when we are approaching the end of that, we take an opportunity to really sit down and reflect in a no blame situation. We call them after action reviews, and we bring in an outside mediator, and it's an opportunity for people to really walk through what went well, what did we do really well over the response, what are areas that we would change, and weaknesses that were shown up. So yeah, I think it certainly exposed some generalized weaknesses of public health. Public health's budget over the last 10 to 20 years has taken a real hit. Federal dollars have really fallen over that period of time. We had a pretty static to decreasing state allotment. And while our localities here in the Blue Ridge have always supported us to the degree that we have asked them to, at the end of the day, I think what this showed was that you need a robust public health infrastructure in place. Because while we did hire really quickly, there is a pretty steep learning curve.
Yeah.
We had to take all of our nursing staff off of all of their nursing responsibilities early on so that they could work on communication and talking to people who were infected with COVID. And that meant we offered no clinical services at all. And we're really a safety net provider for a lot of the clinical services. And so it was a sacrifice of one portion of our service line to meet the needs of another. So I think one lesson I hope globally we've learned is public health has to have good, steady support at a pretty high level, certainly at a federal and state level.
Yeah.
The other lesson that I am currently learning right now is that administration, sort of the backbone of holding an organization together, needs more depth than I gave it. So we have our administrator, who's really the chief operating officer, as you were, the person who sort of holds that together. Got called on military leave. My business manager left. My fiscal tech left, and we had no depth. And so we're holding it together and trying to fill those positions. But that was, again, sort of a personal lesson. Like I made the organization a little too lean.
Gotcha. Well, you know what? That's a really good thing to point out because we work with a lot of small businesses, and I see that as well, that you're vulnerable without that deep, even if it's not in people support, but just having plans if something were to happen. I mean, you're the director of a major initiative. What happens if something happens to you? So you've got to manage, yeah, got to manage that risk. That's such a good lesson, and we need to pay attention to that at all times, right? So
Yeah.
we know what's going on in the world now with the pandemic, and we're coming out of it. Thank you so much for all the work that you and your team are doing for vaccinations and getting the word out, educating people. Tell me a little bit about that process. But then I'd also like to know a little bit more about the health department and what you do servicing people in Louisa.
Yeah. So in regards to the response to the pandemic, we did things pretty quickly early on. So one of the things that we found was that all of our phones were really being inundated with phone calls from individuals in the community that just had really great questions. Things like where could they go to get tested? What were risky activities? What could they do to mitigate their risk? So to help allow the rest of us to do our job, and to make sure the community had the information that they needed, we stood up a hotline and hired dedicated operators to man that hotline. And it was really one of the first hotlines set up by a local health department in the state. And in fact, we still get thousands of calls from our residents every single week. So we're, I think, justifiably really proud of the communication services that we offered early on. We also did a series of town halls very early that allowed the public to call in and get their questions answered using a Facebook and cable network type of situation. As I mentioned, we stood up a containment team pretty quickly. At its height, we probably had 50 people working on containment, and that's calling individuals who have COVID, helping them get the resources that they need, helping them understand what they need to do to isolate, and then contacting each of their contacts to inform them that they need to be in quarantine, and again, help them get the resources that they need to maintain quarantine. Starting in December, January of this last year, we had to stand up a vaccination team. And right now, I think I just counted, we've got about 45 or 50 nurses working mostly part-time for us, but helping us vaccinate individuals and every place, at all the localities, at all of our major ones, and then locally. We have, and then all the support staff that you need to run a vaccination event. So really lots of areas that we've tried to make sure that the community has the resources that they need. In normal times, the health department is actually that place that you don't really think about very much. And that's kind of okay, because that means we're doing our job, right? That means that conditions are safe and you are healthy and out doing things and not having to think about that. And we're okay with that. But just so people are aware, we do some clinical services. We offer family planning. We do treatment for a variety of communicable diseases. We do immunizations for children and adults, do some HIV services and prevention services. But that's really just one part. I think when people think of the health department, they think of a clinic that you go to. And we certainly do that, but we're also where you go if you need a septic system approved or a well or information about those services. And so that's our responsibility, safe water, as it were. We do a lot of other communicable diseases. There's 2 pages of reportable conditions, and we follow up on all of those. So if you get Lyme disease, we'll follow up on that. If you get a food based illness, you get food poisoning, we'll likely follow up on that. We do a lot of emergency planning outside of COVID. We do free flu pods every year to keep our skills up. If in Lake Anna, because of the nuclear power plant, we're involved in that, and were there to be an emergency, we would be involved in sheltering and dispensing of potassium iodide. So lots of things in that arena. And
Wow.
then an area that public health has really been moving into in the last probably 10 to 15 years is what's called population health. And that's really making sure that the community has those conditions that they need to be healthy. And we don't do it alone. That's not anything that we could accomplish alone. But we will work with other nonprofit and governmental organizations to bring together groups to talk about programs that need to be put forward. We'll hold those programs if we don't see an appropriate community organization.
Right.
But we're also happy to just assist other community organizations. So an example of that is a housing program that we run out of the health department that assists people who are HIV positive and at risk of being homeless. So this is a federal program, and we are the group that administers that here locally. It's a great program. Homelessness is really a huge problem. It's hard to be healthy if you're homeless.
Yeah.
But it's, I think, something that you wouldn't traditionally think about public health doing.
Yeah. Well, gosh, all of that, I didn't know a lot of that you guys do. I get a lot of inside or knowledge, I guess, related to the health department from the business side of things, right? So when we're doing festivals or events, that's where my involvement with the health department is. Can you give some information for, our business community? What services, expectations, requirements do they have with the health department, or even just what resources you have available for them? Because, they're weathering this storm of COVID and trying to keep up with restrictions and changes and all of that. Can you give some insight and advice on how to tap into, get resources and get support from you guys for the work that they're doing?
Yeah, absolutely. And I think you bring up a good point. I didn't really talk about food safety, but we are the organization in this state that's really charged with inspecting restaurants and food vendors at those temporary events that you were talking about. And so one resource for businesses that deal with food is that they can call any of our environmental health food specialists and ask questions if they need advice on how to start up service inside their business now, given that the executive orders are gradually being lifted. We have staff members here that can walk through what those requirements are so that you're meeting them and keeping your patrons and your staff safe, but also being successful. And I want to make it clear to the business, we very much want businesses to be successful. We view it as a partnership. Our job is to provide you with the resources and education and support that you need to be successful. It is never our intent to be punitive. And really, if you think about it, in the few situations where we have had to go in and take an action against a restaurant, it's really been a pretty dire circumstance, and no business is going to succeed if their patrons are getting food poisoning.
Yeah.
So I like to think that we're really just acting as a safety net so that the people who come to you are going to walk away with a safe experience. So that's one area. I think if you're a non-food vendor and you're opening up, but you have questions about the executive orders with regard to COVID, or just how to keep your staff safe, you can absolutely call. And again, we're happy to chat on the phone about what are appropriate measures to take. If you have staff and you want to help get them vaccinated, we'll actually come out to your businesses, or we'll work with UVA to come out to your business and do a small scale vaccination event.
Oh,
So for example, if you're working on Main Street in Louisa and you and the businesses on either side get together and say, hey, I have 2 employees that need to be vaccinated. You've got 3, let's call the health department. We will work to make that happen.
oh, wow. That's great. That is good to know. I'm curious. You mentioned the septic systems and getting approval. So do you work with contractors, builders, anything like that that are developing as well. They utilize you when it comes to these kinds of activities.
Yeah. Yeah, the health department no longer designs systems. That was taken out of our mandates a few years ago. We used to, but we very much review all the plans. We certainly work very closely with both soil and engineers that design on-site sewage and septic systems. And we're happy to come out and consult. We're happy to answer questions on the phone. We don't recommend any particular soil person or engineer, but we have a list. If you're having trouble locating one that will serve your area, we can provide you with a list of the people that have said that we can provide their name. So yes, so we're happy to answer all of those types of questions and really be a resource to individuals. And I suspect that most of the contractors know our on-site staff pretty well because they interact with them so frequently.
Yeah, that is great. Gosh, you're such a valuable resource to our community. Thank you, and to all your staff for the work that you do and you continue to do. We're getting to the other side of the pandemic, but health is a never-ending verb, if you will. You've got to keep doing things to stay healthy, right? Because you just don't know what's around the next corner. So thank you for being such a valuable partner and resource. And before we jump off of here, is it new that I think there's 2 people that are now working within the Louisa specific area? Is that right? You have a team?
We actually have so we have 2 locations in Louisa. We have our clinical office, which is over by the Betty Queen Center. And that's where we provide most of our clinical services, or where you would go if you're on the women, infants, and children food supplement. And then we have an office in the county office building where you would go if you need any of those on-site or restaurant types of services. I'll also mention that we provide death certificates and, importantly, birth and marriage and divorce decree certificates. So, and our wait times are much less than DMV. So there you go.
Wow. Yeah.
So
I didn't know you did that.
Yep, we do. You can come and get copies of all of those. So yes, and in fact, we are trying to expand the staff because Louisa is growing so much, and we want to make sure that we're providing good, timely service.
Well, this is great. I just want to say thank you so much for your time today. I certainly have enjoyed getting to know you a little bit better, and I know that we'll be doing more work together as we continue to get through, get through this year and years to come. I just appreciate your assistance and support of Louisa County and the other surrounding counties. Thank you so much for joining us. Just to let everybody know, the Virginia Department of Health, Blue Ridge, they are a member of the chamber. If you do want to get information or get connected to Dr. Bonds directly, you can go to louisachamber.org and get contact information there. But thank you again for your time, and thank you everybody I hope you've enjoyed this Leader Spotlight. Have a great day.